right now, the front line of follicular lymphoma, of course, is represented by bendamustine plus rituximab or CHOP plus rituximab or CVP plus rituximab. Regarding the relapsed refractory patients, there are a few classes of drugs, for example, PI3K inhibitors. The first one was idelalisib, and then there is a new one with the official indication by FDA, is called copanlisib. And this is a very interesting drug when you compare with idelalisib, because in terms of clinical response, according to the Kronos 1 trial where I was involved, I put several patients, the overall response rate is 65% and the CR rate is 14%, according to the best overall response rate, the best CR rate. If you compare with the data of IDELA, they are the same. But if you compare the safety profile of both drugs, there is a real huge difference in terms of extrahematological toxicity. In particular, for IDELA, you can observe in at least 10-15% of the patient diarrhea grade 3 and 4, also colitis, infection, and pneumonitis. This could be a real problem for several patients because they have to discontinue the treatment. On the other hand, with the new PI3K inhibitor, copanlisib, there is a different safety profile. There is a drastic reduction of pneumonitis, infection, and colitis, and also diarrhea. At the same time, there is a specific extrahematological toxicity represented by hypertension and by hyperglycemia. This is no real problem when you compare the bad diarrhea, the bad in terms of grade 3 and 4 pneumonitis, because you can control very well hypertension and at the same time the hyperglycemia. And also these two extrahematological toxicity are present in only the first 4, 6, no more than 8 weeks, and anyway you can control very well during the treatment.
Excellent.
In terms of clinical response, there are no difference when you compare COPA and idelalisib in terms of overall response rate and in terms of CR rate. This is very important. So you have the same result, but at the same time a really different safety profile for your patient with relapsed refractory follicular lymphoma patients.